Hello. I really want this to be up higher. I'm about to try to improvise. So I can sit back. Oh, there we go. Is that going to work? Yes, that works. Yeah, I'm comfortable that way. Let me see here. And there we go. So, thank y'all so much for tolerating me getting all situated. Thank you so much for tuning in to my YouTube channel. I just am so like I don't even know where to begin. Like I normally would have this intro where I would say I'm so excited and but that is not the case today. I just don't I don't even remember like when my life just went it just changed for me. You know what I mean? It's such a difference and I know I keep stuttering over myself, but I was just like I felt like there was a point where I was just so freaking happy. You know what I mean? I was just like super, super happy. And I was getting ready to have my baby. And then I had a miscarriage and I was so devastated. You know what I mean? It was so sad. And I couldn't really figure out what, how to deal with it. I'm still dealing with it, obviously. You can tell I stutter over myself and I'm still very much so dealing with it. And what I came to talk about is so when you have a miscarriage, well, apparently I've never had a miscarriage before, so I didn't really know the procedure or anything that you're supposed to go through when this happens. And so since I didn't naturally pass uh, the baby, I had to get a DNC. That's D and C, not DNC. Like I've taught my whole life. Been saying it wrong. Who would have thought? Whatever. But it's D and C. Look it up. But anyway, so they told me that I had to get this procedure done. And I was like, well, okay. Well, what does it consist of? And they said that they take a little suction tube and they suck out your uterus and they, just clean out the remaining things that was left from you being pregnant and miscarrying the baby. So, I asked a lot of questions because I was so confused, being African American woman. I don't know what it is about having to trust a white man with my black body. It's very, very hard for me. Hey, how y'all doing? How's everybody out there? I am on YouTube Live and I am on TikTok Live, just talking about my experience when I went to the ICU. So anyway, it's very difficult. I don't know if you're out there being a brown skinned woman, it's very, very difficult to listen to someone tell you about what needs to be done to your body and you're not really for sure. And it's not like they're not willing to give you information about you. You know what I mean? Like I want to know what my ultrasound looked like. And so it was such a scary moment. But anyway, when you get a DNC, it's supposed to be approximately like a 20 or 30-minute surgery. It's supposed to be same day. And, um, I don't, well, I mean, I'm talking about having a miscarriage. Who is that? Sure. I've never done that. I probably shouldn't do that right now. That will make sense. Okay. Let me finish this story. Then I'll think about it. But anyway, so when you go and get a DNC, it's supposed to be a short procedure. It's supposed to be something fast that you go in, you're in this, it's the same day. It's the same day surgery. Well, when I went into surgery, I was laying there on the bed and the nurse, she was like super geek because she liked my tattoo on my back. And I was like, oh, that's nice. And then the other lady was like, all right, you're about to fall asleep. And then I woke up. Literally, that's how fast it was. I didn't have like my kids asked me if I had like this cloud moment where I was, out of it or anything like that. No, I didn't have any moments where they said I was going to sleep. I went to sleep and then I woke up. And when I woke up, I felt like I had been under for longer than what I was supposed to. I don't know if that makes sense to anybody. I don't know if that makes sense to y'all. But I felt like I had been out. Oh, SKG, I just love you. How you doing, girl? Um, I wasn't really for sure like how long I was out, but I knew I had been out for a long time and I wasn't supposed to. You know what I mean? Oh no, Nate, you can't. No, not now. This is not a good time for that. So I was like, just looking around trying to get my bearings. And I think this part is cloudy for me because I'm coming out of being in anesthesia for, what I think is 20 or 30 minutes, but it feels like I am so out of it. I'm just so tired. I'm so groggy. And I look over at my husband and, there's nurses around and I'm just sitting there just still trying to wake up. And the first thing they say to me is, you're okay, but you're in the ICU. And I'm like, wait a minute. That is like an oxymoron. Because that is an oxymoron. Because how is it that I'm okay, but in the ICU? Those things don't go together. Those things don't go together. So I'm like, what does that mean? And I'm still cloudy as hell because I've been in anesthesia and put under for all of these hours. And so, like, I think I kind of glanced at the time because for some reason I remember it being 5 something. And I'm like, my surgery was at 12, y'all. My surgery was at 12. So I'm like, what in the hell is going on? So then the doctor comes in and he's like, you lost a lot of blood. And of course, in my mind, in my anesthesia drunken state, a lot of blood to me doesn't even register. And of course, like the doctors don't really give you a blatant explanation. I just feel like they talk to you as if you are a doctor as well. Like they're not really considerate. And then the fact that I just came out of anesthesia, you know what I mean? Like I'm all doped up and you're like, you lost a lot of blood. What does that mean to me? You know what I mean? What does that mean to me? And then the nurse comes in and she was like, yeah, you lost almost 1.5 liters of blood. What does that mean to me? You know what I mean? I'm not like it didn't really click to my brain until my son, he came up to me and he's 17 and I just love him so much. He's so special. But he came up to me and I gave him a hug and I was giving him a hug, happy to be home from the hospital. And I was like, well, baby, I lost almost 1.5 liters of blood. And he said, yeah, that's almost 3 water bottles. That just made my day.
No, you gotta make his voice deeper. That's almost 3 water bottles.
Yeah, that just made my day. It really, really did. But I didn't think that it was so scary. It was so scary and then they just kept telling me, and then y'all listen, the tubes that I had in me coming out of places that, oh my goodness, I had 2 tubes coming out between my thighs. I had 2 IVs in this hand. I had a regular IV and an arterial IV. Then I had another IV in my right hand, and they had to take blood like 3 or 4 times. And I mean, they was just poking the hell out of me. And I mean, I really truly am just grateful that I'm here because the story as I'm waking up and as everybody is kind of relaying to me what happened to me is when they were going in to do the DNC, they thank you so much, baby. Thank you so much. Thank you. I really am so grateful for that. Yeah. Um so what they were doing, I guess while they were going in there, something that they had to take out maybe was embedded too deeply. They don't really give you a clear explanation of anything. At least they didn't for me. And and they said that I just started hemorrhaging and that they couldn't stop the bleeding. And it was even more scary because like my husband, I'm out. It's not like I could tell him don't do this or don't do this, you know what I mean? And I want my stuff, you know what I mean? I want my body, I want my ovaries, I want my stuff. I don't want them to take my stuff. And that was an option. That was a possibility. They said that they could have to do a hysterectomy on me if the bleeding didn't stop. And my husband instructed them to just put a balloon. It's like this balloon. That was one of the tubes that they put inside of my stuff, my hoo ha. So when you are when you get, I guess, with the balloon, I don't really know exactly again how it works. I'm just trying to give y'all my best version because nobody sat down. I didn't get a diagram on how they put this balloon in there, but apparently they put a balloon inside of your your uterus, and that balloon they fill it with liquid, and then once they fill it with liquid that compresses the walls of the uterus to help like clot the blood. You know how if you ever get when you get your IV removed, they ask you to hold it so that the blood could stop. That in a sense, that is what they were doing on the inside of my body. And my husband just said, no, we don't want you going in there trying to burn no arteries. If she could just give her body time to heal, give her body time to heal. And that brought me here with you guys today. It was a very, very scary experience. Like everything that I've been experiencing, I've been um, just wanting to understand why I'm going through the things that I'm experiencing. This is so dark. I just like figured that out. That's so dark. That's so much better. Yeah, so much better. Yeah, that's better. Um, like we all people say you go through things and that this that and the other, but like for all of the things that I've experienced, I mean, I almost lost my life and then losing the baby. Like I guess I can only say that I'm grateful to be here, and I'm grateful for the opportunity to still be able to try and have a baby because we are still able to conceive. So I mean, I'm so grateful for that. I really am. And but I just want my body to heal. It was, it was like I kept like after it happened, I kept thinking that I was just gonna just bleed out everywhere. I would have like these daymares where I would just think, I would get up and go to the bathroom and then, I just pass out because, I mean, it was just the thought of them not being able to stop the bleeding and all of the possibilities. We all know that those things did not transpire and none of those things happened, but it doesn't change the way our minds work. It doesn't change that our minds continue to have these ongoing thoughts and things. It's very difficult to maintain a positive mindset throughout everything that I've been experiencing lately. It really is. And I speak positive mindset all the time. Like that is my number one thing. I love to talk about keeping a positive mindset and looking at all of the things, but and I recognize that it's not really what happens to us, it's how we react to those things that happen to us. So I just want to encourage anybody out there who is, who had to get a DNC or, who miscarried or who is going through anything where you don't really understand your body and you really want to understand what's going on. You want more clarity. I want more clarity as a woman. Like what is happening, what are you doing while I'm asleep? And I mean, I just want to be the support for people who went through something like this because it's so emotional. You know what I mean? It's an emotional experience. It's very emotional, and a lot of the doctors are just insensitive. They don't give you this one-on-one treatment. They're not. I know that they're busy, but yeah, that's the truth. That is a great statement. Somebody said, when we survive the brokenness of our medical system and the suffering in life, we do deep reflection. I did. I really, really, really have been doing some deep diving into what my purpose is on this earth. What my goal is. What am I put here for? Because it was so scary that they just kept saying, you just lost so much blood. You just lost so much blood. And when I went to go get the procedure, like, you had to schedule it and stuff, and they send you appointment reminders. Do you know on my appointment reminders it says miss abortion? That's what it's called. Miss abortion schedule. It was the most depressing thing to go through that in the medical system and just have to experience. I'm like, dude, you don't have another name. I'm not having an abortion. I had a miscarriage, first of all. And it's the saddest thing to experience it. But and then they give you these 2-second conversations, whether you're doped up or confused. You're like, I feel so bad for my husband because they come out and tell him that I lost a whole lot of blood. And then he is forced to make this decision on whether or not what to do. These are our lives, and it's just like, it's just so scary. You know what I mean? It's just so scary just to be. And then I never know what happened. They just tell me I lost a lot of blood, but they didn't. I made up why. They didn't give me no medical explanation of why I started hemorrhaging. Your body just don't hemorrhage. It wasn't hemorrhaging before they went in there. You know what I mean? Oh. No, find more grace and compassion. Yes, yes. But right, like it wasn't hemorrhaging before they went in there, and then they went in there and I started hemorrhaging. And then who do I ask the questions to? How do you figure out whether or not this was something that like just happens? Because I guess I don't know. I'm just again, I'm grateful to be here. After losing that much blood, I'm still actually healing from that right now. Like I get like headaches. Like even now, I got a headache, a super bad headache. It's like right back here where I just have to like, I've been sleeping a lot because it's, healing your blood. Apparently, I learned this, like, I kind of think I knew it, but then again, I guess I didn't. Your blood doesn't just replenish itself. It replenishes itself, but it takes time. So I'm still, replenishing, getting my blood is still on the rise. So I'm trying to eat the right foods, eat iron foods with high iron in them, and beet juice, they say, and liver that I'm not even trying. I'm not eating that. Mm-mm. But but yeah, after that experience, it was a very scary experience, and I don't know why it keeps getting dark like that. It just really was. It was a very scary experience. And did y'all have any questions about the experience? Have you ever gotten a DNC before? Well, YouTube, it's always a pleasure to speak to whomever. Someone is always watching. And I'm just so grateful for the people who tune in. If you've experienced this and you have any questions about my experience, I'm an open book for you guys. If there's anything that you want to know about what I went through, how I was treated there, I can't remember everything off my head. So, but if you have a question, I'm more than willing to answer that about, what I went through, about even if it's about the miscarriage. I just want to be like a helping voice. I don't want to be, I feel like I'm alone, and I know I'm not. I know I'm not. There's groups and clubs out there, but it still feels lonely. Yeah. And this is like the most I've cried on social media and my whole social media about. But I just feel like it's like, it's like it's like a place for, I don't know, it's the place to talk about it. Oh man. But it doesn't look like you guys have any questions. And really, if you are someone who is going through this or has went through this, you are not alone. And it does feel lonely, whether you know you're alone or not. So I'm gonna let y'all guys go. You can subscribe to the channel. I don't normally talk about things like this, but I appreciate your subscription if you want to learn more about healthy hair and scalp care and all of those good things, how to manage your hair, things you should ask your stylist when getting your hair trimmed, um, all kind of tips and tricks on how to maintain your hair at home for yourself if you're dealing with natural hair. And that's what I do. So, but I'm grateful for y'all. Thank y'all for listening and thank you for tuning in. And y'all have a great day. And I'm going to go bye-byes.